Good morning.
Good morning, Carol.
Good morning.
How are you?
Fine,
Good,
thanks.
good.
Good?
Yes.
Thank you very much.
Doctor, good?
Thank you very much for inviting us. Very nice, thanks.
Yes. Yes. Let's start with dementia first.
All right.
What is dementia?
All right. It's a very good question because there is a big confusion about when you say dementia, when you say Alzheimer's disease. Actually, dementia is a condition in which a patient, we all live at one cognitive level. It's very individual. Cognitive means intellectual or whatever you gain throughout your life and how you function, on which intellectual level your abilities are. And it's different. It depends on whether you attended school or not, whether you're reading or not, following news and other things. So what would dementia be actually? Dementia is a process in which a patient or a person comes from one normal intellectual or cognitive level to a lower level. And usually we are talking about a process which takes time. To make a proper diagnosis, it takes 6 months.
6 months.
It takes 6 months is by definition that one goes from one higher intellectual level to a lower intellectual level within 6 months. And then we say dementia. We usually think about, when we say dementia, we think about chronic process that takes time. Actually, it's not necessarily the case. There may be acute conditions in which patient loses cognitive ability and then gains it back some, like in some metabolic disorders, or we can see here in Seychelles a lot of alcoholism, which are actually reversible states. So once you stop drinking, you have very good chances of recovery within the next few months. So that's a sort of dementia which is potentially curable and reversible. What we always...
Potentially curable, but is it curable?
Yes, until one level. When you cross the line, you cannot cure it anymore. That's like with any other disease. So very good thing about, we call them alcohol-related brain disorders. That's a specific form of dementia which is reversible, which is a very good thing. One stops drinking and after a while cognitive abilities come back. So in a few months you have a patient who, we say a new man, right? Who just gains back his long lost abilities and he's not demented anymore. So some dementias are reversible. But the most common form of dementia is actually Alzheimer's disease. So Alzheimer's disease is one of the dementias. And dementia is an umbrella term for the whole big group of the diseases and conditions. And Alzheimer's disease is a disease which is a cause of dementia in, we think, around 80% of all the cases with dementia is actually Alzheimer's dementia. And then we have the other most common is vascular dementia, which is actually rare. But there is a big group of mixed dementias, which is vascular causes and Alzheimer's pathology. And so they all together make around 90% of all dementias. So we usually tend to make it as synonyms, like dementia and Alzheimer's disease.
Yeah, like when can you tell it's dementia or Alzheimer's?
Well, you can say clinically, because Alzheimer's disease has got clinical features. It always begins with memory loss. Always, all right. The most common form of Alzheimer's disease, there are some rare variants of the disease when it may start with visual problems or behavioral changes or some other symptoms, but mainly it begins with memory loss. So that's the main and prominent feature of Alzheimer's disease at the beginning. So you can see one is forgetful, forgets where he put his things. During speech, he's always coming back to the same point, cannot remember what he was talking about. At the beginning, one notices that something goes wrong, but he still manages. So that period, like you can call it gray period or some transitional period between normal functioning and dementia we call mild cognitive impairment. That's actually prodromal phase of Alzheimer's disease. So the patient's still fully functional with an effort. So he's noticing himself, the family or spouses or the people around him can notice some things going on, but he's still fully functional with an effort. And if you do thorough neuropsychological testing, you can find there signs of impeding dementia. So that's the group of the people who will develop dementia. If forgetfulness, if in that case forgetfulness is the most prominent side, you can say this one is at high risk of developing Alzheimer's disease. And then if you do a proper follow-up, you will see that within years that one will develop dementia. So if we have treatment for dementia or way to prevent one from developing dementia, that will be the time when we should start.
So is dementia more than just memory loss?
Yes, it's much more than memory loss. So it begins as a memory loss in the case of Alzheimer's disease. As I said there, it's a big group of diseases. So it may begin with behavioral changes like in some forms of frontotemporal dementia. It may begin as disorders of speech like in primary progressive aphasias, which are also part of frontotemporal dementia. And then we have some variants of primary progressive aphasia. Then we have a big group of dementia in Parkinson's disease, which is a feature for itself. It's a distinct disease, which is probably a spectrum of Lewy body disease dementia, which is now. So this classification and the whole field is very complicated, and it represents many different diseases with many clinical features, which as a whole form only small percentage of all dementias. So that's why we always potentiate, even with Madame Lise in Alzheimer's Foundation. We call, and I think it's very nice that it's called Alzheimer's Foundation, because you emphasize Alzheimer's disease as being the most prominent dementia which affects so many people around us, that you don't think about some, I don't know, rare causes of dementia or rare diseases. So you focus on the most common one, and that's why I think Alzheimer's Foundation is just perfect name for a foundation which will fight dementia globally, all right? But most of them being Alzheimer's.
So for the benefit of the people at home who are watching us now, what is the difference between dementia and Alzheimer's?
Well, dementia is the whole group of the diseases. Like you take all dementias in the world, all the conditions which make people go from higher intellectual level to a lower. Alzheimer's disease has got its clinical features and has got its histopathological features. So if you look at the brain under the microscope of the people with Alzheimer's disease, you will find specific features which will distinguish Alzheimer's disease from any other disease. So it's an entity for itself, but Alzheimer's disease represents 90% of all dementias. It's like we say people, and then we have men and women, and one wonders what's the difference between women and the people. So it's like in the whole group of people, there are women, there are men. So in the whole group of dementias, there is Alzheimer's disease, which is 80–90% of all of them. And then you have another 10%, which is everything else. So why not focus on that Alzheimer's? Because it's a big chunk of dementia. So we have to fight that issue, actually.
And also for now, Alzheimer's is not curable. They're looking for cures.
Do we have anything new regarding curable?
Well, they're always doing research. They're hoping that soon, maybe a few years' time, but it's been very hard.
Actually, it's not very optimistic.
Yeah.
But it's not very optimistic. We have treatment. Yeah. There is some established treatment which may slow down the disease.
What is the treatment?
Well, in early stages, there are basically two groups of medication. One is acetylcholine esterase inhibitors, which we use in early and moderate stages of mild and moderate stages of Alzheimer's. And then we have on the other side NMDA receptor antagonists, which we use in moderate and severe phases. So it's about medication. And we have a medication to control behavioral and psychiatric symptoms of dementia, which is very important, which those symptoms are very disabling and very disturbing for patient and the family. But these first ones, anti-dementia drugs, they are very, their effect is very moderate. So it's not something that you can lean on in the treatment of Alzheimer's. And research is not very much promising. So in next 10, 15 years, we will not have treatment at least. And I don't think we will have during our lifetimes here. That's why what we have to focus on is actually care of the people with dementia. So what we really can do, we can offer a life with dignity, to keep people functional as much as possible, to keep them with the families, to promote family values, to have people with dementia in the society living normal or as much normal life as possible, and to enable them that's the way actually to extend their lives and to fight the disease.
Yes, and
so
manage the disease. It's very, the education is very important to know how to manage the people, how to handle the patient itself, and also for the carer and the family.
But can patients with Alzheimer's or dementia hurt themselves?
Very much so. Oh yes, they become like a child. At a certain stage, when they become like a child, if you think of a 2-year-old child, you wouldn't leave that child in a house by itself, because they become just like a child. So you need to have somebody to be taking care of them 24 hours a day.
And as we are talking, there is a text. Bonjour, how much will it cost the government to treat Alzheimer's diseases?
Well, in the survey, from overseas, they're saying that Alzheimer's disease costs 6 times more than a patient with heart disease or cancer. So here, we don't know yet, as we are still in the early stage where we are doing the research, where we are working on to get something done for it.
So we're talking about stages. How many stages are there?
If I may add something, sorry, to the previous. So we're not talking here actually about the care, about the treatment. We're talking about care.
Okay.
And there is a very big issue here in Alzheimer's disease that is called caregiver. So one demented patient requires 24-hour caregiver, whether it's a member of family or a professional caregiver. So you are binding one healthy, productive person only for yourself, 24 hours. So cost is actually double. It's not only about the one who's suffering, it's about one more who's taking care of. So that's why we are here, Madam Church and me, and I'm very much engaged in Alzheimer's Foundation. So we are trying to work together like civil, non-government sector and ministry to handle the things, because the disease is massive. Disease is massive. Our estimation here is that between 500 and 1,500 people are there in Seychelles only. And most of them are not diagnosed. Most of them are not getting treatment. Most of them are at home with all those complications of Alzheimer's, and they present a big burden to the society. So that's why we are trying to talk as much as possible and to promote the disease, and that we get the patients and do something on the national level, which there is a lot actually going on there. Sorry, what was your question?
We were talking about stages, and now my question is, how many stages are there?
Well, it depends the stages. I always like to classify them, Alzheimer's, in 3 stages. All right. First, actually, we have always, I already said, that mild cognitive impairment when patient is still functional, but with effort. So once, and it's a rate that within 3 years, 50% of people with mild cognitive impairment will become demented. Whether it's Alzheimer's or other sort of dementia, it's usually Alzheimer's because it's most common, right? But that's the stage where we should get the patients, and it's very difficult. So it's a very big issue in the most developed countries. Very few people are diagnosed at this stage. And then comes the stage of mild dementia, when people are forgetful, are demented, something obviously is going on there, they require some support from the family, but they still got insight in what's going on. That insight is very important there because they lose it. So at one point people don't realize that something wrong's going on, and there we are entering already in some moderate stage of the disease where all the symptoms get worse, and then the troubles start with sleep disorders, with behavioral changes, depression, apathy. Hygiene is not good anymore. People start not to take care of themselves anymore as usual. People change, so that's personality changes. So it's not the same person anymore. It's not the same person anymore. It's very hard to accept that once mother or father are not the same person as they used to be. They just have to be taken care of. And then at one stages, usually at late stages, when people are fully dependent on others regarding all the daily activities, we have that big problem with behavioral and psychiatric symptoms of dementia, such as hallucinations, delusions. Delusions actually occur very early in the disease, that someone's trying to steal your money, someone is around the house, you have to lock the doors.
You're hearing voice, somebody else.
That's hallucinations, that's hallucinations. They come in late stages, but imagine your life that you cannot make new memory, that you are forgetful so much that you must feel insecure, frightened for everything, so you don't feel safe at your home, in your room. You have to lock the doors, shut down the windows, hide the money. So that must be, I mean, I cannot imagine how difficult it must be for the one who's suffering.
But how can we prevent it? Alzheimer's, dementia, can we prevent it?
Well, I think the living style, your lifestyle, is very important. So far, that's what they think.
Yeah, there was a few studies actually. It's always, when we talk about this, we are always citing that a big American study that was conducted some years ago, I can say 5-6 years ago, which showed actually that risk factors are same risk factors as for brain stroke or myocardial infarction. So it means diabetes, hypertension, smoking, heart diseases, and then comes diet, physical activity. Education is very important. So what one was, which school one attended, how much intellectual work one did during his lifetime, like reading, watching TV, news. So basically healthy lifestyle may prevent Alzheimer's disease in huge number of cases. So that's the only what's proven so far that may prevent Alzheimer's disease and other dementias as well. And actually that every society is trying to improve those risk factors, because then you benefit in so many fields, and eventually you get people who live longer. So that is why we have that this topic is very interesting in not only in Seychelles, worldwide. This is very hot topic worldwide, because lifespan is getting longer, and the main risk factor for Alzheimer's disease is actually age.
What is the age group?
Usually Alzheimer's disease occurs at the age of 65 plus.
65.
When it occurs before 65, then we think about some other forms of dementia, but it's pretty rare that people younger than 65 get Alzheimer's disease. So 65 and older. So the older you get, the higher risk is that one gets Alzheimer's disease. So as the lifespan is growing and getting more and more the number of people with Alzheimer's diseases, and now it's becoming alarming, you know, the average lifespan is how much, 80 something.
Right.
Can you believe, like 100 years ago, average lifespan was 50 years. You know, the first Alzheimer's patient, Alzheimer himself, the German neurologist who described the disease, he described it in a 50-year-old. And she was an old lady at that time. Only 100 years ago, we're talking about 1901.
Yeah.
Is Alzheimer's genetics?
There is some some cases with genetical background, and there have been few genes identified so far, but basically it's not genetic. So there must be genetic susceptibility. So there is always a question why some people are getting Alzheimer's disease, but most of people don't. So there must be some genetic susceptibility, and then you have factors from your environment which will wake up those genes, or something will make it function not really right, and those people will get Alzheimer's. Same like in so many diseases, like in Parkinson's, multiple sclerosis, myocardial infarction, diabetes. So it's actually a syndromic disease. So each condition that can damage your brain may lead you to dementia, like head injuries or alcohol or some other things.
We have a text.
But we think we never talk about genetics and about the risk of getting Alzheimer's if one is diagnosed after the age of 65. So yeah, that's why 65 is that limit, because before the age of 65, 50% of dementias, when they're diagnosed, 50% are not Alzheimer's, it's something else. And there is, in these other conditions, there is much stronger genetical background there. So younger people than 65, when we diagnose with Alzheimer's disease, we can think about genetics going on, but it's 1 to 2%. So it's not significant.
It's not significant. So we have a text. Say, what is the prognosis of the dementia? From which stage of life does it start to develop? How far into the sickness do one start showing its symptoms? So there is two or three questions in it.
Okay, we just said about the age.
Okay.
So 65 is the limit. So rarely you will have a patient with dementia who's younger than 65. Then the investigations have to be more thorough, seeking for some other cause, or clinical presentation is atypical the younger the patient is. But basically, people above the age of 65 get Alzheimer's disease. So what is the prognosis with Alzheimer's disease? Specifically, it's...
What is the prognosis of the dementia?
So it's 4 to 9 years. It's expected lifespan.
4 to 9 years.
4 to 9 years. Of course, it may vary greatly. Depends on how good care is and on the nature of the disease, and every person is individual. So it can, but basically the older the patient is, the more rapid is the progression. So this prognosis is not same in a 90-year-old patient like as it would be in 65-year-old patient. So that's what we can expect, this life expectancy. And I think I already gave the answer when we went through the stages of the disease, how the disease develops. All right, but eventually the patients with the Alzheimer's will die with will end up bedridden and completely unable to control their body functions, and someone needs to feed them, someone has to take care of them, and usually our patients with Alzheimer's, they die with some somatic complications, most common lung infection, and urinary infection. There is some other complications which are very common. It's a hip fracture. And such, you may say, bizarre complications. They are not bizarre, they just got nothing to do with Alzheimer's, but that's how usually patients with Alzheimer's die.
But also, I think if the Alzheimer's patient just have Alzheimer's, don't have this disease like diabetic or heart disease, then they can live longer. But if they have the diabetic, heart attack, cancer, and then of course the lifespan is much shorter.
So tell me about the foundation, Mrs. Church. What are you doing at the moment? Anything new?
The foundation, we started by causing awareness, which letting people know, and we're doing as much education as we have. We've been knocking on doors like the Global Brain Health Institute and University of Washington, and sending the expert here. And right now, in fact, tomorrow, we'll be receiving a group from Sweden, where we were invited to visit them last September. Our Minister of Health went with us.
We've seen it on the news last night regarding Alzheimer's and dementia, and MOUs being...
Yeah, the minister will be signing, Minister of Health will be signing an MOU with the Swedish delegation to, there'll be the part for dementia, but it's mostly like geriatric. They're coming here, and they have one person, a gentleman who will be helping the foundation with the design of the memory care unit, which is very important, how the place is designed to make it Alzheimer's friendly. And but Dr. Jezik will tell you more about the Swedish delegation on the geriatric side, which... Okay.
Yeah, right. This Swedish delegation, they are coming here as a cooperation which was established actually by Alzheimer's Foundation, and they are coming from city of Umeå and University from Umeå. That's one of the top Swedish universities, and especially medical schools. Right. I will remind your viewers that Sweden is the country where Nobel Prize is given, all right? So they're at that level to decide who's getting the Nobel Prize, and they are university which is giving Nobel Prize laureates. So anyway, they are very much willing to help us, and we visited Sweden and saw how nursing for old people and people with dementia functions in ideal settings. So that's,
and they have really good care for the elderly. They really
that is the best elderly health care in the world. So we are trying to follow their steps, and they are willing to help us very much, and they're coming here to support us and help us build a system which will take care of the elderly people in general, with focus on dementia and Alzheimer's disease as something which is emerging and becoming massive. All right, but we are talking about geriatric care in general, and as a part of that is dementia as a massive thing there. So there will be memorandums of understanding signed between University of Umeå about the possibilities that we get education there and training and for people of Seychelles,
professional and caregivers. And also
and then
on our
the
program,
city of Umeå and the hospital in Umeå. So there will be three
Ministry of Health.
Ministry of Health.
And and so it will be mixed delegation of politicians, health professionals, and people who are designing nursing homes. So we wanted to have them there to help us because the plans are big. We are trying to renovate and to work on the place we've got now. It's a notice point to make it better for elderly in general, and with big support from Alzheimer's Foundation to make one part of that just for Alzheimer's patients, because they need and require special attention and special health, and to develop the services which will improve quality of life of all our Alzheimer's patients, whether they are at the end stages and require institutionalized care in the home, or they are not in that late stages, and we can enable them to function well at home within their families.
Yeah, and we'll be having, we need to let the public know that we'll be having talks on Friday morning, 8:30 or 9 o'clock at the Khalifa building.
This Friday.
Right? It will be for the public on caregiving and explaining about Alzheimer's. Right, doctor?
Yeah.
Yeah. So the public are invited. They can call us, or they can just turn up on Friday morning at the Khalifa building, where they will learn more about Alzheimer's and what we are doing.
It's only about Alzheimer's.
Dementia in general.
Yeah. Yes. Yeah.
Okay. So Alzheimer's is on the increase in seizures, but what does it do to your body?
Well, as we said, it's in increase for several reasons.
It's more to your mind than to your body.
Yeah. But one is that we managed to develop some services and to promote these Alzheimer's and take people out of their homes, because we're trying to break that common opinion, that it's normal when you get old. It's normal that you're forgetful. It's never normal. It's always a sign of disease. So, but it's common opinion that when you get old, you just get I don't know.
So forgetful. It's not normal.
No,
aging.
it's not normal. It's
Right,
never ever normal, no matter which age it occurs. All right. So if you have a 90-year-old who is forgetful, it's very indicative.
Yeah.
Very indicative. 30% of 90-plus-year-old people will suffer from Alzheimer's disease. So we are trying. That's what Lise said about public awareness, to to teach the people that there is something wrong going on. It's not right, that we can do something for the people with Alzheimer's. So, and we are managing. So we can diagnose those people, and we are diagnosing more and more. And it's not a taboo anymore to talk about dementia. Everybody's talking about it.
That was the problem before. People were scared. They knew there was something wrong with their parents, but they were scared to talk about it. They think that the parents had become crazy. Because
or you're ashamed of your parents.
Their personality changed. They're becoming a different person. And to them, they thought, oh, my parents has become crazy, so I don't want to tell people about it. Instead of coming out and find help, which now they are doing, and help is there. It's very important for the family and for that patient.
So after diagnosis, how much does a patient live?
Yeah, we said about around 3, 4 to 9 years. Depends on, it's very individual, the progression of the disease and how the patient is taken care of. And
taken care of, and also if they have other complication, like if somebody doesn't have diabetes, doesn't have other disease, they could live 8, 11 years. But if they have complication, other kind of disease, then
it's pretty individual. It's pretty individual. But what we can do with drugs, we can slow down the disease, at least give 1 more year of quality life, which is not unimportant, I think.
Yeah.
And what we can really do with medication is to control psychiatric symptoms. So to regulate sleep-wake cycle, which gets disturbed very early in the disease, you know, that, and then to control hallucinations, delusional ideas, and all those things. But there is the whole myriad of non-medical symptoms that we can do for the patients with Alzheimer's to enable them normal life. So but it's a bit difficult question after the diagnosis. What you can expect there, it's very individual.
Yeah, but also it's very important.
But there is a way
that the caregivers, especially if they are like family caregivers, that they have a break, because it could affect them very much. Yeah.
Yes, the whole field now being born from this. It's caregivers problems, and we are trying to focus on to work with caregivers, to train them how to do the job properly.
They need the training, I think.
Yeah, to prevent them from burnout, which is very big thing.
And they have to have the patience.
Yeah. Yes.
Yeah, and they are
but
facing.
If they train how to manage these people, if they understand the disease, they know, they understand and realize that these people are not doing it on purpose. So then they know how to handle that person. But if you're not trained, you don't understand the disease, then it's very difficult. It's very hard on you. And especially the family, they really need to get educated about the disease.
They need to understand the patients as well. Yes. Once understand dementia or Alzheimer, they need to understand the patient as well.
Yes, definitely.
Yes. Yeah. So before we end our conversation this morning, any take-home message for to benefit the people who are watching us this morning? The patients, maybe?
Well,
the caregivers, caretakers?
The caregivers and the family caregivers, ask them to be patient, to go out and learn about the disease, understand the disease. The foundation, we have a support group. We have an office now which is open on Tuesday and Thursday from 10 a.m. to 3 p.m. And we have support group. It's on Premier Building, room 107. And we're hoping to, in future, to be able to open longer, but we need manpower. So we ask people who wants to help to come and join us, and we'll help to man the office and be able to talk to the family who's seeking help. And sometimes all they need, the family, is to be able to talk to somebody and somebody to listen to them. And then you can help them. Well, you're not the only one there. And that's what you could try to do to help the situation. And so we are really urging sponsors to help us to raise funds to create the unit over there in Northeast Point. So that now that the Ministry of Health has given us the place, so we have to renovate it. And with the Swedish group here, we're taking another step forward, because now we will know how to renovate the place to make it Alzheimer's friendly. And we just need our sponsors to think about helping us. You know, we are ready to go as soon as we get the funds. And we got great help from Ministry of Health, and we have Dr. Jessic, who is really devoted, I would say, to this disease, to help the Alzheimer's patients. So we are very lucky in a way, and we have all these people from overseas who's also willing to help us. So now it's up to us, Seychellois, to help ourselves.
Before we conclude this, Dr. Hectic, there's one question for you. He said, ask Dr. Hectic if he have this information. Has there been any record of patients below 65 years old anywhere around the world?
Yeah, of course. Actually, by definition, Alzheimer's cannot be younger than 49. So, of course, there is always exceptions that confirm the rule. but it's not very likely that Alzheimer's disease occurs before the age of 65. Of course, we have younger patients, but it always has 65 is made there as a sign for a doctor to think, like if it's 65, below 65, maybe it's not Alzheimer's. Let's seek for something else. That's the sign, because 50% of the patients below the age of 65 are not Alzheimer's patients. It's some frontotemporal dementias are the most frequent in younger groups if we are talking about neurodegenerative diseases. So that's the diseases with unknown cause, such as Alzheimer's. But we have to think about alcohol-related brain disorders, which is massive again here in Seychelles,
yes.
right? Then we have to think about metabolic disorders, about hypothyroidism, which is very common, especially among the women. Then we have to think about depression. Many patients I have diagnosed in my career who were younger than 65, and then you think, oh, let me see what's behind that. It's maybe not Alzheimer's, and I diagnosed many cases of depression, which actually slows you down, makes you forgetful. Sometimes it's very difficult to tell between. Then we have AIDS dementia, AIDS-related disorders, among which is AIDS dementia, which is again pretty common here in Seychelles, and we have people with dementia. But basically, older people than 65, that's the group which is at risk that we have to focus at. And my takeaway message would be that any kind of forgetfulness, of excessive forgetfulness, of not being able to function properly at your home, in your environment, may indicate dementia in older people. Older, we're talking about 65.
Okay.
And I would just add one more thing, if I may.
Please.
Somehow we didn't mention during this conversation that we had in November, we had Professor Rhodes from Washington University, and he was guest here in Bunzu SSL. So it was very important visit for us, because they will help us develop the national plan, and we are working now on development of the national plan for people with dementia, which will actually make short-term, mid-term, long-term goals for the country to develop the services for old people with dementia. And once it becomes political document, and then the whole infrastructure will have to be devoted and made proper for Alzheimer's patients, and it will be a big thing. Not many countries in the world have plans like that and that sort. So, but it takes a long time we have to build institutions but we are starting now.
Yes, we are going forward, which is good.
And we have good support from most renowned international.
The top. We've been having support from the top. University of Washington,
who have already done and went through this,
research,
and we have their unselfish support to do the things right.
I wish we could continue on talking on these diseases, but time is not in our favor. So we had to end our conversation this morning, but I'm sure during this year we can meet again to talk about AIDS dementia, which is a new topic I've just heard now. But I want to thank you for this morning to come on this invitation to talk about dementia and Alzheimer's. Where are we now? So thank you so much, Dr. Alexander and Mrs. Church.
Can I just say one more thing to our people, to Seychellois? Peut-être moi là dit en créole. Vous connaissez pour dire sa maladie là, il peut pas aller. Alors nous tous peut-être nous pas connaître qui ça n'a, nous qui capable gagner sa maladie. Alors on nous aider nous tous pour nous faire un endroit qui, si nous gagnons, nous connaissons, nous pour confortable. Parce que ça qui Alzheimer's Foundation peut faire pour un endroit pour rester, qui vous connaît, pour dire, il y a des gens for sure qui peut prendre soin ou peut occuper qui va finir la vie dans dignité au lieu où tout seul dans la case il n'a pas personne pour occuper. Ça qui m'a dit. Alors tout ça bon petit monde qui est capable à aide-nous. Dans nous autres CSA money quand même on parle de donation si tu donnes une donation c'est bien. So c'est moi peut demander aujourd'hui. À nous joindre même ensemble, faire la vie, est capable nous, faire la vie nous nations, nous-mêmes, nos parents, confortable. Merci.
Merci, Mrs. Church. Merci, Dr. Alexander. Et moi, pour souhaiter autres bon sens, pour tout bon support qu'ils ont besoin aussi.
Merci, Carole.
Voilà, au de la cour, tu peux suivre Topic Conversation aujourd'hui dans Bonjour Cécile. Topic aujourd'hui par YouTube, c'est dementia avec Alzeimers. Et moi, si on gagne plus bien comprendre ça des maladies. Merci pour qu'il texte nous.